Week is Nurses Week, and to celebrate, we wanted to highlight all of the work that they do. And maybe if you're thinking about becoming a nurse yourself, talk a little bit more about that. So we want to welcome in Ursula Lawrence right now with Infirmary Health to talk more about this. So first of all, if the pandemic has taught us anything, it's that we desperately need health care and our nurses, all the time.
Absolutely. Nurses were there at the bedside with these COVID patients and during the pandemic, whether that was in the ED or upstairs once we admitted these patients. We value our nurses and we thank them for everything that they've done, and they're resilient. They've done a fantastic job.
Yes, absolutely. I have a lot of my friends are nurses, so big shout out to all of them and all the nurses out there. This is all about them. So what is Infirmary Health doing to kind of honor them and to think about them and let them know that they're appreciated?
So we kicked off Nurses Week last week, ending today on Florence Nightingale's birthday, and we did Blessing of the Hands today for all the nursing staff. We had rounding and doing the blessings on the units, took it to them, and we will end that again tonight for the night shift nurses. And we started off with lots of food trucks of their favorites, a lot of feeding, and some gifts to them also.
That's great. Everybody loves a little meal and a nice little gift.
Absolutely.
Talk about, just the things maybe people have misconceptions about nurses or the hard parts of being a nurse that, people don't see all the time.
Well, it's definitely a scheduled shift. We definitely do at the bedside 12-hour shifts. They are the coordinator of that patient's care. They have the most interaction with the patient than anyone else. They are the communicator to all the other disciplines, whether it's physical therapy, speech therapy, and definitely, they're the support for the physicians. But number one, they're the advocate for the patient to communicate what's going on with those patients to the physicians so that we can make sure that they're getting the care that they need.
Absolutely, and I know it's very important to family members to have that kind of nurse there to know that their loved one's being taken care of too, because they're going to see the nurses maybe more than they'll see the actual doctors.
Absolutely. They're actually the communicators to the family.
Yes. And talk a little bit about Infirmary Health and how it partners with schools locally. If you might be thinking out there that, hey, I want to become a nurse, I want to get into this field, talk a little bit about some of the opportunities.
So Mobile Infirmary Health is very advanced in making sure that we are looking every way that we can to recruit nurses as well as grow new nurses in the community. So number one, we've partnered with University of Mobile and brought back a 2-year program. They currently had a 4-year program, so anyone can go back and finish up their baccalaureate, but we felt that sometimes shorter goals encourages people to go back. Yeah. We also partnered with Coastal Alabama, and we are working with the state and Coastal to do an LPN apprenticeship program. We actually are kicking that off in May with Coastal, and we will be kicking off our RN apprenticeship. And if nobody understands what an apprenticeship is that when they are working their clinical hours for the school, hours that need to be met on each semester, they are working at Mobile Infirmary one-on-one with an experienced nurse who becomes their preceptor or journey worker, and they're getting paid during their clinical hours.
That is very important.
It's
for
very
the experience and for them getting that little pay bit, because I didn't when I interned, so that's awesome.
Yes, it is, and they're getting that one-to-one during all their clinical hours versus in a group.
Absolutely. Well, thank you. We're out of time, and I appreciate you so much for being here. Nurses are something that are still needed. There are plenty of jobs, of course.